Hello all, I'm Dr. Tushar Raut. I'm a consultant neurologist at Kokilabha and Dhirubhai Ambani Hospital. So today here we are to get some more knowledge about the emergency situations in epilepsy, how to identify them, what all do's and don'ts that we should follow whenever we are coming across any such emergency situations, and what attention that needs to be given by the caregiver who is standing by side of the patient having an epileptic seizure. Epilepsy, you know, that is a very common neurological condition where you get seizures. That is, there is jerking of the upper and lower limbs, the whole body, and there you can have loss of consciousness. You may have frothing from the mouth. You may have tongue bite. You may have uprolling of the eyes. So with or without, different combination of symptoms can occur. Sometimes they are big seizures, what you call like a generalized tonic-clonic seizures, and sometimes they are very mild seizures or subtle seizures, what some people call it as a absence spells, blank staring, loss of memory for some time, and then they are disoriented, confused, and then they take some time to come back to normal. So these are the different types of seizures, like generalized seizures, which is involving the whole body, and focal seizures, which is involving only a particular limb, that is upper limb, lower limb, or only one side of the body, and then they may or may not have loss of consciousness, those with focal seizures. Now, what are the conditions where does the emergency part come? Because many of the epileptic seizures are usually self-remitting. That is, after 1 or 2 minutes, they will subside. The patient will come back to normal. Then he will visit his doctor or his neurologist, get the investigations done to know what is the cause of epilepsy. Some patients are a known epileptic. That is, they are having seizures since long time and they are on some medications or the other. So usually they are aware of what seizures they usually get, and you know what are the precautions that need to be followed, what emergency medicine that needs to be taken. But some patients are not aware, and for them it is a first time episode. So those patients or their relatives panic the most. So in those cases, you have to have a background knowledge of what are the do's and don'ts. Like the most important thing in epilepsy is that it is a treatable condition first place. So you should know what is the cause of seizures. Like sometimes some patients have a family history, genetic condition. Sometimes they have electrical instability, which is detected on the EEG in the brain, and their MRI may be normal structurally. So it is more of a network issue or a circuitry issue. Some patients may have a structural problem in the brain, like brain TB, brain infection, meningitis, encephalitis, a stroke, after that head injury. Sometimes you have a scar in the brain because of a head injury, or a surgery in the past, brain surgery or tumor surgery, tumor evacuation. So depending upon the structural or non-structural causes, these patients have epileptic seizures because of the irritation of the brain because of these causes. So when a patient has any some form of seizure or epileptic attack, he should rush to the nearest emergency or the nearest doctor or the neurologist who is well versed with handling cases of epilepsy, because if you don't treat or if you delay, the chances of getting bigger seizures, longer seizures are high. Now, what are these red flags or the emergency situations regarding seizures? So that we have to be very careful. You know, we have to know the red flags. So the most important is any seizure which is lasting for more than 5 minutes. That means it is a warning sign. He may land into something called as a medical emergency, which is status epilepticus, where the seizures continue to happen one by one, and patient is in coma or he doesn't regain consciousness in between. And what are the other thing, that is the serial seizures or a flurry of seizures or a cluster of seizures, where you have a seizure, you are a little bit all right, and again you have 1 or 2 seizures, then you are disoriented. So whole day goes by in having these seizures, which is also not good, because one seizure will be a will form a substrate for the next seizure. So you will continue to get back-to-back seizures if you don't treat them timely. And then there are certain notorious epilepsies which are known to occur every now and then, and despite of taking medicines, you may need to add 2-3 medications to it. So they are like very resistant epilepsy or medically refractory epilepsies, which is because of some sclerosis in the brain, like mesial temporal lobe epilepsies, because of some dysplasias or some developmental abnormalities in the brain. Some certain meningitis can also, or encephalitis can trigger a flurry of seizures, and that could be status epilepticus. So to prevent permanent damage to the brain, because if the seizures are just one odd episode, then they don't cause damage. But if they continue for a long time, then you can have a permanent damage in the form of memory loss, in the form of speech issues, in the form of weakness on one side of the body, in the form of some kind of a confusion, disorientation, which can persist for longer, behavioral changes, psychosis. So in order to prevent such devastating consequences of status epilepticus, you need to identify and rush to the nearest hospital. Whenever a patient gets a seizure, the first and foremost thing is don't feed anything orally, don't ask them to sniff anything. You have nowadays midazolam nasal sprays, which are available on prescription from a doctor or a qualified neurologist, and you can use it and spray it 2 to 4 puffs in each nostril. The package insert gives all the instructions how to use the spray. At least that can avoid the seizure to some extent if it is getting back recurrent or back-to-back seizures. And then you have to rush the patient to the emergency, because the importance of giving IV medication is very important, and stabilization of the breathing, circulation, airway, blood pressure. So whatever IV fluid, saline, medications in the injectable form can be given immediately, and the effect kicks in very fast, so that the patient doesn't land up with significant brain damage. And the second thing is that patient needs to be, if they are not able to breathe well, they have heavy breathing, aspiration sometimes during a seizure, the saliva goes into their windpipe, so then they land up with a pneumonia. So those patients may need some temporary ventilatory support, which is okay. So this is the ICU management that continues after the patient comes to the emergency, and then they have to be stabilized, given the appropriate medications, and then slowly stabilize them and get out of the ICU after antibiotics and all supportive care. So that is one aspect. So that is the reason you have to recognize if a patient is not waking up in between, he's confused, he's disoriented, and he's getting some focal twitches here and there. That means there is something happening in the brain which is silent or subclinical. And those are the cases where you have to rush to the hospital for starting immediate treatment. And EEG can be done in the ICU or in the casualty, MRI can be done. So to attain the diagnosis, sometimes a lumbar puncture or a fluid can be tapped from the CSF or the spinal canal, and accordingly you can have a diagnosis of meningitis, like bacterial TB, whichever is the cause. And blood workup is done, like sodium, calcium, magnesium, sugar. Sometimes high sugars can cause something called as non-ketotic hyperglycemic seizures. Low sugars can cause seizures and significant brain damage. So these are the other treatable or modifiable causes of epilepsy which you need to watch out for. Now, the second thing is as I told you, don't feed the patient during that time. Give the nasal spray, comfort the patient, turn the patient to one side, let the saliva drool off, so that don't try to put any object in the mouth. Otherwise, you'll hurt yourself, or the patient may cause more trauma and more complications. Usually it settles down in some time. Keep sharp objects away. Comfort the patient. He should not hit himself anywhere or hurt himself. So these are the basic precautions which need to be taken. Patient can have a card with him, where the doctor's and the patient's relative contact number is there, and what medicine he is on can be written on that. What is the diagnosis can be written. So that card can be very handy for bystanders if someone gets an epileptic attack on the road or any unknown place, or he's traveling somewhere where people are not familiar to him. So they can at least access to that card and have a basic information and inform the emergency doctor when the patient reaches the emergency or the casualty. So that is also very important to know about having an emergency card in such cases, especially revealing the identity and the other medical details. So the third thing is you should know what is the type of epilepsy. At least the patient should be counseled at whether it is known to occur every now and then, whether it is resistant to medicines, whether it is simply responsive to medicines. So that we are more careful. You should have a proper sleep, because sleep deprival is a risk for seizures. And medications on time, that should be make sure that medication should be administered at the right time, right dosages. What has been given, you should never compromise on the dose or or even changing the brand. Some patients have been given a particular set of drugs at a particular brand. That also it's advisable not to change in epileptic patients. Otherwise, changing a brand also can be an issue, and you have to always consult your doctor before you do that. Certain antibiotics or new medications prescribed by our family doctors or physicians can also interact with the epilepsy drugs and reduce the efficacy of the drug, and you may land up with a seizure. Smoking, alcohol, some substance abuse, cocaine, any form of barbiturates, any form of drugs like even your cannabis, ganja, hashish, all those drugs can also lower the seizure threshold and you can land up with epilepsy. So you have to be very disciplined in your lifestyle and stay away from these toxins and drugs, and just stick to your regular medications to prevent epilepsy. Timely sleep, as I told you, is very important. Exposure to very bright lights, flickering lights, disco lights can trigger an epileptic attack. So that we have to be careful. Having your meals on time is important to some extent, and hormonal imbalance or changes can also trigger seizures. So you should be, as a female, you should be knowing about your menstrual cycle and any other complications which you have during the period. So this is like analyzing your own body, like as to what are your needs in terms of when you are an epileptic patient, what discipline you should follow in terms of your diet, exercise. Ketogenic diet or modified Atkins diet is very effective in reducing the risk of seizures. So diet which is high in proteins and fats and low in carbohydrates, more of nuts, vegetables, salads, milk products, cheese, butter. They are beneficial for chronic epilepsy patients to reduce the seizure threshold. And as I told you about the medications, the sticking to the brand, the dose, and timely follow-ups, regular visits to your neurologist is very important. Otherwise, you may miss out on the dose or the schedule, and then it can be detrimental because if your seizure is well controlled, it is well controlled, but it doesn't take much time for you to go off track, and you land up with a flurry of seizures because it's not good to have seizures again and again despite of medication. That means your medications are failing or your body is resisting to the medication. So then you land up with more dosages of the drugs, more different varieties and combinations, and that causes more side effects and drug-drug interactions. So that is the reason always from the initial days try to be very disciplined in terms of your lifestyle and regular follow-ups. So, friends, I think this was my suggestion and viewpoint on emergency situation in epilepsy. If you are, some patients unfortunately have some cardiac arrhythmias also because of the ongoing seizures, and that can lead to death also. So, knowing cardiopulmonary resuscitation, CPR as a citizen, as a Indian citizen, it's very important. If you have basic training in life support and resuscitation measures, so that also will be handy if some patient has breathing issues and drop in the oxygen levels, and you have to call the nearest ambulance if you cannot transport the patient. So this is only in cases of ongoing seizures, status epilepticus that I call, and rest of the things we can follow as we have just discussed. So to summarize, I would say epilepsy is definitely a treatable condition. You have to know the different types of epilepsy. Every patient should be aware of what is the mechanism, what is the cause of epilepsy, why is he getting seizures, whether it is genetic, whether it is some electrical instability, whether it is because of some structural problem in the brain. Accordingly, what medicines he is on, what dosages he is on, he should be aware. And he should be aware of timely dosing of the medications, what interactions can occur, what are the do's and don'ts in terms of the diet, exercise schedule. Of course, we ask them to avoid driving, swimming, and some dangerous activities which an epileptic patient cannot afford to have a seizure during those activities. So yeah, so those things you have to remember. And of course, yoga, meditation, exercise is always beneficial to kind of give more endurance and improve your tolerability in terms of having the negative impact or the consequences of the seizures. It is very important to control the seizures with the midazolam nasal sprays, if possible, outside the hospital, or you can rush to the hospital and get themselves injected with the appropriate drugs. The more the time delayed, the more the damage to the brain. So it is very important to attend the epileptic seizures timely, and at least someone should be there to kind of have a supervision on the patients who are epileptic, so that they don't go with the unnoticed seizures for a long time, and that can lead to coma and other complications. Thank you.